In the world of healthcare, what you say and how you say it can save a life. Welcome to a platform where pharmacology meets master-level clinical communication. From guided training modules to hyper-realistic AI patient role plays that actively adapt to your choices. No static questions, no predictable scripts. This is clinical communication evolved. This is PRESCOM AI.
Medical and pharmacy students often struggle to bridge the gap between textbook knowledge and real patient communication. PRESCOM AI solves this challenge through an intelligent virtual patient platform that trains, evaluates, and improves prescription communication skills. The system combines clinical pharmacology, patient counseling, medication safety, and communication assessment into a realistic AI-powered simulation environment. Hello, doctor. I am PRESCOM AI. I simulate real patients with different diseases, personalities, concerns, fears, and medication-related questions. You can practice counseling me exactly like a real patient. The platform contains 27 clinical modules covering infectious diseases, cardiovascular disorders, diabetes, emergency medicine, reproductive health, immunization, and drug administration techniques. I provide 3 learning modes: training mode, interactive role-play mode, and examination mode. In training mode, students learn pharmacology and communication skills. In interactive mode, the AI adapts its responses dynamically. In examination mode, the AI evaluates the student's performance using a structured 30-mark assessment rubric.
Hello, Mr. Anand. I am Dr. Sharma. How are you feeling today? Hello, doctor. I'm very worried. I've been coughing for weeks and now I've been diagnosed with tuberculosis. I'm a school teacher and I'm afraid of infecting my students. I understand your concern, Mr. Anand. Tuberculosis, or TB, is a lung infection caused by bacteria. The good news is that TB is completely treatable when medicines are taken correctly. Will I recover completely, doctor? I really want to get back to my students. Yes, most patients recover fully when they take the complete course of treatment without missing doses. You prescribed 4 medicines. Why do I need so many tablets? TB bacteria are strong and can become resistant if treated with only one medicine. Using multiple medicines together helps kill the bacteria effectively and prevents resistance. Doctor, you mentioned hepatotoxicity. What does that mean? That's a great question. Hepatotoxicity simply means some TB medicines can affect the liver. Most patients do well, but you should report symptoms like yellow eyes, severe vomiting, or abdominal pain immediately. My friend told me TB medicines can turn urine orange. Is that dangerous? No. One medicine called rifampicin can make your urine, sweat, or tears appear orange red. This is completely normal and harmless. If I feel better after a few weeks, can I stop taking the medicines? No. Even if you feel healthy, some bacteria may still remain in your body. Stopping early can cause drug-resistant TB, which is much harder to treat. Okay, doctor, I understand now. I will follow the treatment exactly as you said. Before we finish, can you tell me what you understood about your treatment? I need to take all my medicines every day, complete the full course, not stop early, and contact the hospital if I develop serious symptoms like yellow eyes or severe vomiting. Excellent. You've understood correctly. We'll support you throughout your treatment. Thank you, doctor. I feel much more confident now.
Hello, Mr. Vikram. I am Dr. Sharma. How are you feeling today? Hello, doctor. I've been having high fever, chills, and sweating for the last few days. The laboratory said I have malaria. I need to get back to work quickly. Is it serious? I understand your concern. Malaria is an infection caused by parasites that are transmitted through mosquito bites. The good news is that it can be treated effectively with the right medicines. Will I be able to recover completely from this? Yes. Most patients recover completely when they take the full course of treatment exactly as prescribed. You've prescribed several tablets. Why do I need them? These medicines work together to kill the malaria parasites in your body and prevent the infection from coming back. It's important to complete the entire treatment course, even if you start feeling better. Doctor, you mentioned hypnozoites. What does that mean? That's a medical term for dormant malaria parasites that can hide in the liver and cause the illness to return later. Some medicines are given specifically to eliminate them and prevent relapse. Before starting one of the medicines, you're checking my blood for an enzyme deficiency. Why? That's an important safety check. Some malaria medicines can cause problems in people with G6PD deficiency, a genetic condition. Testing helps us make sure the treatment is safe for you. If I feel completely fine after 2 days, can I stop taking the tablets? No. Even if your fever disappears, some parasites may still remain in your body. Stopping treatment early can lead to relapse or drug resistance. Okay, doctor, what should I remember? Please tell me what you've understood. I should take all the medicines exactly as prescribed, complete the full course, undergo the recommended blood test, and not stop treatment early, even if I feel better. Excellent, you've understood correctly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. I wish you a speedy recovery.
Good morning, Mrs. Pawar. I am Dr. Sharma. How is Rahul feeling today? Good morning, doctor. Rahul has had a high fever, headache, and rash for several days. We were told it is scrub typhus. I'm very worried about him. I understand your concern. Scrub typhus is a bacterial infection that can occur after exposure to infected mites, especially in rural or grassy areas. The good news is that it responds very well to the antibiotic we've prescribed. What medicine will Rahul need? I've prescribed doxycycline. This antibiotic helps kill the bacteria causing the infection and usually leads to significant improvement within a few days. Doctor, you mentioned chelation and esophageal ulceration. What do those words mean? That's a great question. Chelation means that certain foods, like milk and antacids, can bind to the medicine and stop it from working properly. Esophageal ulceration means irritation of the food pipe, which can happen if the medicine is taken without enough water. Can I give the capsule with Rahul's morning glass of milk? No. Milk, dairy products, and antacids should be avoided close to the time of taking this medicine because they reduce its effectiveness. Give the medicine with a full glass of water instead. How should Rahul take the medicine? He should take it with plenty of water and remain sitting or standing for at least 30 minutes afterward. This helps prevent irritation of the food pipe. I read online that these medicines can permanently stain children's teeth. Should I be worried? In younger children, that can be a concern. However, Rahul's treatment has been carefully selected considering his age and medical condition. The benefits of treating this infection far outweigh the risks, and we'll monitor him appropriately. Let me make sure I understood. Rahul should take the medicine with a full glass of water, avoid milk and antacids around the dose, stay upright afterward, and complete the full course. Excellent, you've understood perfectly. Do you have any other questions? No, doctor. Thank you for explaining everything clearly. You're welcome. Rahul should start feeling much better soon. Please contact us if you have any concerns. Good morning, Mr. Mehra. I am Dr. Sharma. Please have a seat. How are you feeling today? Honestly, doctor, I'm terrified. I was diagnosed with HIV during a blood donation camp. I don't know what this means for my future. Am I going to die? I understand how overwhelming this news can feel, but I want to reassure you that HIV is now a manageable long-term condition. With proper treatment, people living with HIV can live long, healthy, and productive lives. Really? I thought HIV was a death sentence. That was a common belief many years ago. Today, we have highly effective medicines called antiretroviral therapy, or ART, that can control the virus very successfully. You said the treatment suppresses viral replication and prevents immunological failure. What does that actually mean? In simple terms, the medicine stops the virus from multiplying in your body. This protects your immune system and helps you stay healthy for many years. What medicines will I need to take? You'll be starting a standard ART combination containing tenofovir, lamivudine, and dolutegravir. These medicines work together to keep the virus under control. What happens if I miss my medicines while traveling or working late on weekends? Taking your ART regularly is extremely important. Missing doses repeatedly can allow the virus to become stronger and may reduce the effectiveness of treatment. Try to take your medication at the same time every day and carry it with you when traveling. Doctor, I'm worried about my job. Will my employer find out about my HIV diagnosis? Your medical information is confidential. Healthcare professionals are legally and ethically required to protect your privacy. Your diagnosis will not be shared with your employer without your permission, except in very specific situations required by law. Can I take any over-the-counter medicines I want? Not always. Some medicines and supplements can interact with ART. Please consult your doctor or pharmacist before starting any new medication. Let me see if I've understood. I need to take my ART every day, avoid missing doses, check before taking new medicines, and my medical information will remain confidential. Excellent, Mr. Mehra. You've understood correctly. Do you have any other questions? No, doctor. Thank you. I feel much more hopeful now. You're welcome. We will support you throughout your treatment journey. Good morning, Kartik. I am Dr. Sharma. Please don't worry. This is a confidential consultation. How can I help you today? Thank you for being honest, Kartik. These symptoms are common in certain sexually transmitted infections, and seeking treatment early is the right thing to do. There is no need to feel ashamed. Most sexually transmitted infections can be treated effectively when diagnosed early. Based on your symptoms, we'll start appropriate treatment and may perform additional tests if needed. In simple words, your symptoms may be caused by more than one type of bacteria, so we use medicines that treat the most likely infections at the same time, even before all test results are available. You'll receive antibiotics that target the common causes of urethral discharge, such as gonorrhea and chlamydia. It's very important that you complete the full course exactly as prescribed. Yes, many people with sexually transmitted infections may not have symptoms. If your partner is not evaluated and treated, you could pass the infection back and forth, leading to reinfection. No, it's best to avoid all sexual activity until both you and your partner have completed treatment, and your symptoms have resolved. This helps prevent reinfection and protects your partner. Yes, I recommend confidential screening for other sexually transmitted infections, including HIV, syphilis, and hepatitis, because these infections can sometimes occur together. Excellent, Kartik. You've understood correctly. Do you have any other questions? You're welcome. We're here to help, and your information will remain confidential.